dear students, welcome back to the GDC classes. So dear students, here is another video for the MRB Pharmacist exam preparation under the Master Stroke series. Today we are going to take the questions, important question from the topic under the Pharmacotherapeutic, and the topic will be covered under this video, that is the endocrine and nervous system. Nervous system, mainly the central nervous system, we are going to talk in this videos. So for all your MRB Pharmacist exam preparation, GDC is continuously trying to their level best so that we can provide all the important things for all of you, and each in between the time we will guide you according to the preparation also. So here, this topic in this video we are going to cover the endocrine system. Endocrine system means, yes, hormone and the different type of the endocrine gland and their secretion, their function, something like that, as well as the central nervous system. So what is the first question under this series? Here, which is the symptoms of diabetes? So first of all, what is the diabetes? Diabetes is the situation when there is the increased blood sugar level, that is the diabetes. This diabetes can be two types: type 1 diabetes, type 2 diabetes. Type 1 diabetes is called as the insulin dependent diabetes mellitus, while type 2 diabetes is called as the non-insulin dependent diabetes mellitus. In the type 1, there is the decreased secretion of insulin, while in the type 2 diabetes, there is the chances of the resistance of the insulin that cannot even bind with the receptor, or that cannot activate the receptor, or they cannot produce their effect. So in case of the type 2, insulin secretion not decreases, even insulin's concentration increases. And when the diabetes will occurs, that will lead to the frequent urination. Yes, increase hunger means, yes, increase urination, increase weight loss. All these situations can be happen. So yes, all of these are the correct answer. Means the diabetes will have the different type of the situation called as the polyuria, polyphasia, polydipsia, weight loss, fatigue, blurred vision, slow wound healing, recurrent infection. All these situations can be happen there by the diabetes mellitus. Next, what drugs are used in the treatment of diabetes? So now when we come to the treatment of diabetes, mainly insulin is there, firstly, which is given, but that is taken through the parenteral route, through the subcutaneous route. Now the oral hypoglycemic agent have introduced. These oral hypoglycemic agent have the different type of the mechanism of action. Out of that, their main property is two things. First, increase the insulin secretion if insulin secretion is decreased, or decrease the resistance or overcome the resistance if there is the development of resistance happens, that receptor cannot bind with the insulin, cannot bind with the receptor, or cannot produce the action. So here, sulfonylurea, sitagliptin, metformin. Sulfonylurea, under the sulfonylurea we have the two subclasses: first generation sulfonylurea, second generation sulfonylurea. First generation sulfonylurea known as the tolbutamide, chlorpropamide, and second generation drug called as the 4Z drug: glibenclamide, glimepiride, gliclazide, glipizide. These all are the second generation sulfonylurea derivative. Sitagliptin comes under the sitagliptin, veldagliptin. These all are the DPP4 inhibitor. Gliptin is there, DPP4 inhibitor, and metformin, that is the biguanide class drug. So correct answer will be yes, all of these. Here D answer will be correct, because all these situation here increase the insulin secretion, overcome the resistance. So here is the insulin, rapid acting, short acting, intermediate, long acting, and oral hypoglycemic agent like biguanide, metformin, sulfonylurea, glipizide, glimepiride, gliclazide, meglitinide, repaglinide, netaglinide, thiazolidine dione, pioglitazone, rosiglitazone, alpha glucosidase inhibitor, acarbose, miglitol, DPP4 inhibitor, gliptin class drug. These are the different drugs which used for the treatment of the diabetes. Next question, what we have? Type 2 diabetes is characterized by type 2. Recently what we have come through the type 1, that is the insulin dependent diabetes mellitus. Type 2, that is the non-insulin dependent diabetes mellitus. So in the type 1 there is the decreased secretion of insulin, while in the type 2 there is the increased secretion of insulin that cannot bind with the receptor. So here absolute lack of insulin, no. Increase in insulin secretion, yes. There is the hyperinsulinemia in type 2 diabetes. No change, that is the incorrect. So correct answer will be the B, because in the type 1 insulin secretion decreases, in type 2 insulin secretion increases. Insulin secretion is there, but that insulin cannot produce their action due to the development of resistance. Type 1 diabetes is caused by, type 1 diabetes mellitus is also called as the juvenile onset diabetes mellitus. Means mainly it happened in the children from the beginning. That can maybe due to the environmental factor or genetic factor, genetic predisposition. All these situations can be happen. So here genetic factor, environmental factor, all can be considered as the cause for the type 1 diabetes mellitus. So correct answer will be the C. So type 1 diabetes, genetic factor, autoimmune response, or the environmental trigger, these all the situation which can cause the type 1 diabetes. Which of the following is not a symptoms of hyperthyroidism? Now what is the hyperthyroidism? When there is the higher secretion of the thyroid hormone T3 and T4. Due to the hyperthyroidism, there can be the different type of the syndrome can be developed, in which what we have the, yes, thyroid hormone are mainly responsible for the BMR maintenance, basal metabolic rate, as well as they regulate our body appetite also. So when the hyperthyroidism is there, then heat intolerance, tachycardia, decreased appetite, or weight loss. What can not? Here is not a symptoms of hyperthyroidism. So yes, the correct answer will be the decreased appetite. It cannot happen. In case of that, what happened? Weight loss is there, tachycardia is there, heat intolerance is there. These are the different symptoms of the hyperthyroidism. Even irritability, anxiety, and common symptoms. These are the common symptoms which can happen with the hyperthyroidism: weight loss, rapid or irregular heartbeat, anxiety, shaky hands, increased sweating, can't stand heat, increased appetite, menstrual changes, heat intolerance, trouble sleeping. All these situations comes under the hyperthyroidism. When the body does not respond to the insulin, it makes this is not respond to the insulin. That is type 2 diabetes mellitus. Not respond to the insulin. Correct? Type 2, that is also called as the non-insulin dependent diabetes mellitus. What are the two hormones produced by the thyroid gland? Thyroid gland have the two types of the cells called as the follicular cells and parafollicular cells. Follicular cells produces the T3 and T4, that is called as the triiodothyronine, and tetraiodothyroxine, that's simply called as the thyroxine. While C cells or parafollicular cells produces the calcitonin. So what is the correct answer? Yes, triiodothyronine and thyroxine, these are the thyroid hormone, also known as the T3 and T4. Vasopressin, oxytocin, posterior pituitary prolactin, anterior pituitary relaxin is the endothelial. So all of these cannot be happen. So correct answer will be the A. Thyroid glands produces the T3 and T4. These are the tyrosine based hormone. That's why they comes under the nuclear acting receptor. Which drug is used for the Parkinson disease? What is Parkinson? Parkinson is a neurodegenerative disease where actually what happened? The imbalance between the acetylcholine and dopamine. What happened? Dopamine concentration decreases in our brain while acetylcholine concentration increases in our bone. And mainly Parkinson disease develop into the decreased concentration or the decreased dopaminergic neuron in the substantia nigra. For that, we have to increase the dopamine level. But dopamine, since cannot cross the BBB, that's why the precursor of the dopamine, that is the levodopa, is given that can easily cross the BBB. So correct answer will be the levodopa. Verapamil is a calcium channel blocker. Amitriptyline, that is the antidepressant class drug. and Zumab, that is called as the that angiogenesis inhibitor. The correct answer will be the levodopa. Apart from that, under the Parkinson treatment, what the drug we use? Dopamine precursor, levodopa. Dopamine decarboxylase inhibitor, which reduces the levodopa metabolism in the periphery, that is the carbidopa benzerazine. MAO B inhibitor, salazalin, rasazelin. COMT inhibitor in tacapone, tolcapone. So here is the levodopa. These are the DDC inhibitor. These are MAO B inhibitor. Here we have the COMT inhibitor, NMDA receptor antagonist. That is the agonist. That is the amantadine dopamine facilitator called as dopamine agonist, bromocriptine, propinerol, pramipexole, pergolide. These are the drug can be given, as well as centrally acting anticholinergic drug by benzopro, means benzexol, bypyridine, the procyclidine. These drug can be used. Amnesia refers to amnesia. I have a memory loss. I have a amnesia. Means amnesia, lack of the loss of the memory. Amnesia. And another one what we have, that is the dementia. Dementia. Memory loss, amnesia. But short-term memory loss, that is dementia. So here correct answer will be the amnesia, memory loss. But short-term, like in the Alzheimer, what we have? Dementia, short-term memory loss. Recent action we cannot recall. Impaired perception of time, fear of social stimulation. No, the correct answer will be the amnesia, refers to the loss of the memories, including fact, information, and experience. Symptoms include memory loss, confusion, inability to recognize the familiar faces or places. That is the amnesia. Parkinson disease is also called as idiopathic Parkinson, paralysis agitation, primary Parkinson. Sir, all of these can be answered. Why? Under the Parkinson, what actually happened? Under the Parkinson, there is the situation of the trap. Means tremor, rigidity, akinesia, postural imbalance. These are the different situations of the Parkinson. It may be due to the idiopathic situation, or we can say Parkinson disease in brain disorder that causes the unintended, uncontrolled movements such as shaking, stiffness, difficulty, imbalance in coordination. So that's why it also called as the primary Parkinson, paralysis agitans, or idiopathic Parkinson. These all are the different names of the Parkinson disease. For the complete preparation of your MRB Pharmacist examination, JDC have introduced the MRB Pharmacist theory book and MRB Pharmacist objective book. Both books are available in the Amazon and Flipkart. You can directly order these books for your better preparation for the MRB Pharmacist examination. What are the non-pharmacological management of epilepsy? Non-pharmacological management of epilepsy. Pharmacological means with the drug. When we treat any disease, that is called as the pharmacological treatment. But here, non-pharmacological. What can be happen? For the control of the epilepsy or management of epilepsy, we can give the ketogenic diet. Yes, it can. We can stress the management, manage the stress, or acupuncture, alternative therapy. Yes, all these situations can be applicable as a non-pharmacological management of the epilepsy, because these are the just symptom based. These are the just relaxes our body. Ketogenic diet is there, lifestyle modification there, vagus nerve stimulation, stress management, acupuncture. There are surgical procedure also which can be applied for the epilepsy treatment. Clonic seizure is associated with lip smacking, muscle stiffness. No, it's jerky muscles. During the seizure, what happened? There is the recurrent episodes of seizure, and there is the jerky movement in our muscles, that is called as the clonic seizure. Absence seizure, that is petit-mal seizure also called as, where eye blinking, lip smacking is there. In the tonic seizure, there is the stiffness of the muscles. Atonic seizure, there is the loss of the muscles control. Here mainly drop down their heads. Clonic seizure, there is repeating jerking muscles movement. In the tonic clonic seizure, they can be sudden conscious or body stiffening or shaking will be there. Due to the different types of the epilepsy, different type of the symptoms can be happen. Alzheimer's disease is the most common cause of malnutrition, dementia, fatigue, or psychosis. Now, here is the dementia. That was the amnesia. It's dementia. Why? Short-term memory loss. Why? Alzheimer's disease, why actually it's happened? Alzheimer's disease is a neurodegenerative disease where actually what happened? There is the in the Alzheimer's disease actually what there happened? Mainly there is the decrease in damage of the cholinergic neuron due to the beta amyloid protein formation in the cholinergic neuron, and that neuron get damaged. So Alzheimer's disease in the dementia is a brain coordination condition that causes a progressive decline in memory, thinking, learning, organizing skills. Eventually, person's ability to carry out the basic activity. Most common cause of dementia, yes, Alzheimer's is there. Aphasia refers to inability to express through speech, memory loss, inability to recognize familiar object. No, aphasia means when we cannot express our thought through the speech, or we cannot understand the speech through their expression, that is the asphyxia. So inability to express through speech. Aphasia is a brain disorder where a person trouble speaking or understanding other people speaking, means when the coordination is not there with the two person. Who proposed the amyloid hypothesis? John Hardy and David Ellsworth proposed the beta amyloid hypothesis, that beta amyloid protein when developed on the cholinergic neuron, there is the breakdown of these neurons. That's why it's called as the neurodegenerative disease, that is Alzheimer. While Hippocrates, father of medicine, Louis Pasteur, that is the, yes, they have a pasteurization theory. So correct answer will be the John Hardy, and yes, amyloid hypothesis was first proposed in 1991 by the John Hardy and David Ellsworth. They found a pathogenic mutation in the, yes, AB means beta precursor protein gene on the chromosome 21, which suggested that APP, mismetabolism and deposition were the primary events in Alzheimer's disease. Simply we can say there is the beta amyloid protein formation in the cholinergic neuron. A stroke is also known as heart attack, cerebrovascular accident, meningitis or myocardial infarction. Myocardial infarction is called as the heart failure, heart attack. But here stroke is called as the cerebrovascular accident. Cerebrovascular accident, where there is the cerebrovascular means hemorrhage will be there, or cerebrovascular collapse is there, blood vessels collapse is there. So these cerebrovascular accident can also called as the stroke. So a stroke is known as the cerebrovascular accident, is a medical condition that occurs when there is the sudden disruption of the blood supply to the part of the brain. Due to the hemorrhage, due to the bleeding, there is the less supply of the blood into the different parts of the brain, that will develop as a stroke. So the disruption can occur either due to the blockage or bleeding. The reason can be anyone. Correct? Strokes are caused by blood clot, yes. Busting of blood vessels in the brain, yes, it can be. So correct answer will be both A and B, because less supply of the blood. Maybe reason will be the different one. But yes, if less supply of the blood into the different parts of the brain, that will lead to the stroke. Which of the following drug is used to treat stroke? Anything which can increase the blood supply to the brain parts. Maybe it can anti-hyperlipidemic, maybe it can antiplatelet drug, or it can also be the blood vessels dilator also. So here atorvastatin, that is the statin class HMG-CoA reductase inhibitor, yes, it's a anti-hyperlipidemic drug. While alteplase, that is the fibrinolytic class drug, clopidogrel, that is the antiplatelet drug, yes, all of these can be applicable under the stroke treatment. So in the stroke treatment, we give the tissue plasminogen activator, that is called as the fibrinolytic, that is the antiplatelet alteplase, where streptokinase, urokinase, alteplase, reteplase. Next, endovascular thrombectomy, antiplatelet agent like the aspirin, clopidogrel, as well as ticagrelor. Anticoagulant, warfarin, dabigatran, rivaroxaban, apixaban. Blood pressure management, anti-hypertensive drug is there, as well as the statins, atorvastatin, simvastatin can be also used. Which of the following is a stage of the migraine? Prodrome, attack, aura. Initially what we have the acute attack. Then there is the aura formation and prodrome situation. So all are the different stages of the migraine development. In the migraine development, firstly there is the prodrome phase. This phase occurs hours to days before the headache, means before. In this phase characterized by the subtle changes that can signal an impending migraine. Then aura phase, then headache or attack phase, then postdrome phase will be there. So yes, prodrome, aura, headache or attack phase, then we have the postdrome phase. These are the 4 phases of the migraine development. Ophthalmic migraine, ophthalmic migraine refers to loss of vision. Ophthalmic, loss of vision. Yes, obviously. So ophthalmic migraine, retinal migraine, this rare type of migraine involves the temporary vision loss or blindness in one eye. Normal vision, temporary ocular migraine. Why? Because if we have the one eye blindness, then definitely the whole picture cannot be seen. Only one part of that can be seen. After you just close your eye, you can see from up to the here only. But after opening both eye, you can see up to this position also. Correct? Which of the following is a type of migraine? Vestibular migraine, chronic migraine, hemiplegic migraine. Yes, all are these type of the migraine. Because migraine what is? Actually, there is the increased cranial pressure into the cranial nerve. And if that is damages that cranial nerve, so 12 prayer, anywhere, any cranial nerve can be damaged, and according to that, different type of the situation can be there. It can be the vestibular migraine, chronic migraine, or ophthalmic migraine, menstrual migraine, migraine with aura, or we have the hemiplegic and the aciplegic migraine. These are the different type of the migraine and their variation. Ischemic stroke may be due to, as its name indicates, ischemia. Ischemia means less blood supply. If there is the less blood supply, then thrombosis, embolism, atherosclerosis can any be the reason for the ischemic stroke. Atherosclerosis, thrombosis or embolism. Which of the following is the clinical manifestation of a stroke? Dizziness, weakness, loss of coordination or balance, vision problems, slurring. Clinical manifestation of a stroke. Yes, all of these. When there is the less supply of the blood to the different parts of the brain part, then there can be the dizziness, weakness, loss of coordination, vision problem, anything can be happen. So these are the different type of the stroke symptoms. Which of the following is not the symptoms of prodrome phase? In the migraine, what we have gone, that is the different stages of migraine: predrome phase, aura, attack phase, then we have postdrome phase. Correct? Under this condition, fatigue, mood swing, food craving, irritability, dyspnea, sleep disorder, frequent yawning, increase in thirst. Not the symptoms of prodrome. So, sleep disorder, obviously, under the prodrome phase, sleep disorder cannot happen. It can happen after the postdrome. Remember it. In the prodrome, 248 hours, here fatigue, cognitive difficulties, mood changes, food craving, neck pain, yawning. But we have the difficulty in the postdrome phase, their feeling of the tired or very difficulty with the concentration. That can develop the sleep disorder. Here, under the headache, we have the nausea with the vomiting, photophobia, phonophobia. These are the situation is there under the headache phase. While under the aura phase, visual aura, sensory disturbance, speech disturbance, motor disturbance, these can happen. Which of the following is the non-pharmacological management of migraine? Regular exercise? Yes. Manage stress? Yes. Cognitive behavioral therapy? Yes. So all of these can be there to control non-pharmacologically the migraine. Because in the pharmacological treatment, we carried out into the pharmacology. So this is the pharmacotherapeutic, where we actually apply the art and science of the treatment of disease. It can be with the drug or it cannot also with the drug. So both situation can be there. Which fundamental hypotheses are proposed in Alzheimer's disease? Amyloid cause hypothesis. Yes. Tau hyperphosphorylation hypothesis, cholinergic hypothesis. So yes, hypotheses are all, but actually the best suited theory, that is the beta amyloid protein development, means beta amyloid protein cascade. Cholinergic hypothesis, amyloid hypothesis, tau hypothesis. So these are the, in the tau hypothesis, tau protein buildup inside nervous cell bodies causes the neurofibrillary tangles. Which of the following is not the non-pharmacological management of Parkinson disease? Balanced diet, speech therapy, less sleep, exercise. No, less sleep cannot be the any management for any disease. Good sleep is very important for proper management of any type of the neurological disease. Exercise, yes. Occupational therapy, speech therapy, nutritional support, these all are the non-pharmacological treatment of Parkinson. Which of the following drug comes under the anticoagulant therapy for stroke? Anticoagulant therapy. Here, what can be happen? And warfarin, dabigatran, but topiramate, no, it's an anti-epileptic drug, not an anticoagulant. So correct answer will be yes, both A and B will be there, because warfarin is oral anticoagulant. Dabigatran xylate is the oral direct thrombin inhibitor. So these the drug we already have gone through in the classification. Which of the following is the trigger factor for migraine? Trigger factor for migraine means which factor can trigger the migraine? Hormonal factor, environmental factor, neurological factor. Yes, all of these factors can trigger the migraine, because migraine can be by the any reason. It may be due to the neurological factor, vascular changes, environmental factor, or we can say the condition any applicable regarding the pathogenesis of the migraine. Muscle stiffness caused by which of the following? Muscle stiffness. Myoclonic seizure, absence seizure, tonic seizure, clonic seizure. Stiffness is there, so definitely that will be the tonic seizure, because already we have gone through in the absence seizure there is the eye blinking and lip smacking. In the tonic seizure there is stiffening of the muscles. In the atonic seizure there is the loss of the muscles control, or we can say the fall down or drop their head. In the clonic seizure there is the repeating jerking muscles movement. In the tonic-clonic seizure, they can cause a sudden loss of consciousness also. That's why called as the generalized tonic-clonic seizure. These were the 30 important questions under the pharmacotherapeutic subject, and the topic was the hormone and the CNS. I hope these questions you have gone through. These are very simple questions, but very important questions for your exam preparation purpose. So in this video, that's sufficient for today. In the next part, we will cover the next important question. And if you have any query, you can comment on the comment box. Definitely, we will try to our level best to handle all your queries. So thank you so much to all of you. Thank you all.